Hi, thank you so much for letting me talk about the Relational Playbook for healthcare teams. I have some no disclosures and I have some funding to acknowledge. My research focuses on understanding and optimizing the culture of healthcare to enhance employee well-being and patient safety. My interest in this work came from my 20 years of clinical practice as a family nurse practitioner and epidemiologist. I helped develop and implement evidence-based practices to enhance the quality, safety, and equity of care. I asked teams to implement checklists or new complex procedures without considering the context and how these programs might impact employee well-being. I've been learning about context as part of my work in the Veterans Health Administration, and I've been learning how to create programs that protect employee well-being. But to be honest, I have a long way to go. And the reason why is researchers like myself and administrators, right? We just keep piling things on, expecting more and more of healthcare teams, without addressing the poor teamwork and broken systems that have resulted in crisis levels of burnout and turnover in healthcare. So my research is focused in the Veterans Health Administration, and I have been working to find ways to optimize the culture. I am currently funded by a VA Career Development Award to study how to build supportive learning environments in VA cardiac catheterization laboratories. Supportive learning environments are those that empower teams to trial, adapt, and adopt innovations while using highly reliable work practices such as huddles and debriefs. I have assessed the state of learning environments, identified positive relationships with supportive learning environments, and employee engagement and well-being measures. And I developed a team-focused culture change intervention, which I called the Relational Playbook. The next step is implementation and the tricky task of getting people to put this research into practice. My work is guided by the Designing for Dissemination, Sustainability, and Equity framework. Aim one of my research was conceptualization, determining the need and demand, and establishing the evidence base, which I did through 2 national surveys, interviews, and literature reviews. Aim two was designing the Relational Playbook product, messaging, packaging, distribution, and design outcomes. I am now in the dissemination and impact phases. During the conceptualization phase, I identified concepts that VA cardiac cath lab teams used to build supportive learning environments. They created a positive work culture. They hired and trained for teamwork. They followed a servant leadership philosophy. They created joy in work, and they used communication and high reliability best practices. When I went into the literature, I learned that these practices were used in fields outside of healthcare. The gap I needed to address was how to adapt these evidence-based interventions for busy healthcare teams and disseminate them to ensure equitable adoption and sustained implementation so positive impacts can be realized. I designed the playbook as a single source for the research-based resources and evidence-based interventions that cath labs shared with me. The content is presented as micro-learning, which is an approach to teaching and delivering content to learners in 3 to 5 minute bursts at the point of need with a focused and specific learning outcome. This is different than traditional e-learning approaches that require you to sit down at a computer, have a pre-test, take an hour-long learning, and then do a post-test. The first edition of the playbook was a 250-page PDF that was broken down into different chapters. Chapter 1 teaches teams how to create a positive culture. Chapter 2 covers all aspects of teamwork, from how to build a team to develop high-quality relationships at work, to hiring for performance. Chapter 3 introduces wellness-centered and servant leadership. Chapter 4 reveals methods to create joy in work. Lastly, Chapter 5 guides teams to communicate effectively and how to integrate high reliability practices into the flow of work. Here is an example of a practice from Chapter 1. If a team wants to create a positive culture, they would be directed to start with the 3 good things practice. In the first week, participants would be asked to write down 3 good things that went well on that day and why that happened. So it's a self-focused intervention. In the next week, the participants would weave this practice into one-on-one meetings with colleagues, asking them to reflect on the good parts of their workday. Once the participant experiences the benefits and gets comfortable asking the questions, they are then asked to weave 3 good things into weekly team meetings and huddles, with the goal of making this a standing agenda item. So here's an example from Chapter 2. If a group wants to build or rebuild their team, they would be directed to the Walk in My Shoes relationship building exercise. This exercise provides a space for staff to tell in a meeting or show through job shadowing what it is like for them to do their job. The goal is to increase knowledge and awareness about team members' day-to-day work experiences. The playbook was reviewed by 6 experts from the fields of organizational psychology, high reliability, education, and VA clinicians. They deemed the playbook resources and interventions feasible, acceptable, and appropriate for implementation. They also suggested 3 things we should do to increase the chances the playbook will be successfully implemented. The first was to enhance the user experience by transferring the content to a digital platform with more visuals and explanatory videos. The second was to create a learning environment diagnostic tool so teams can pinpoint areas for improvement and then be guided to certain chapters. And the last was to figure out how to nudge playbook users to adopt and sustain implementation. In the short term, we move the content to a VA SharePoint site to increase the ease of use and accessibility. Very soon, we will be building a VA-hosted WordPress site so the content can be accessible outside the VA firewall as a desktop and mobile app. We adapted the 58-item learning environment assessment survey that we used in AIM-1 to a 13-item assessment tool for teams so that they could complete them to guide these questions, to have these questions guide them through the playbook and also do a periodic evaluation of progress. We loved the nudge idea and designed a brief survey using behavioral science principles that will be sent to participants first thing in the beginning of the week and then at the end of the week to remind them what work they're doing that week and then to collect information around what interventions they actually did, how it went, any changes made, and any wins. The nudge survey also collects reach, adoption, adaptation, and fidelity data. The value proposition for the playbook is that the Relational Playbook is designed to help teams thrive in the workplace, not just survive. The playbook is a locally focused program designed by and for healthcare teams. The playbook provides practical entry-level tools designed to fit seamlessly into daily meetings and huddles, making it easy for busy managers and staff to incorporate into their routines. The playbook complements national VA initiatives by offering evidence-based interventions that empower teams to take control of their work environments without lengthy trainings or online learning modules. Teams who implement the playbook interventions will experience meaningful changes, including the creation of supportive learning environments. Research has shown that supportive learning environments are associated with employee well-being, which is measured through increased job satisfaction, lower burnout, and turnover. Though the Relational Playbook is a workforce development initiative, I have received report from veterans. I presented this work at a national VA meeting and connected with J.P. Nolan Jr., who is a veteran and a research advocate. And he asked me to share this with you. He says, "The VA is committed to the veterans they serve. It's time the VA commits to the people who serve veterans. The Relational Playbook is the first step." There has been a lot of interest in the playbook from within and outside the VA. Last year, the playbook was patented by the VA Technology Transfer Office due to its potential for commercialization to benefit veterans and the American public. And we have also been funded to implement the playbook in 3 different programs, the first being at the University of Colorado in their Department of Medicine. And we are using Whistle Systems, which is a software-based platform designed using behavioral science principles that is pushing playbook content to participants to identify, if that platform is a feasible, acceptable, and appropriate way to deliver this culture change intervention. We also will be working with the VA Office of Rural Health to implement the Acute Inpatient Medicine, High Reliability, Learning Environment, and Workforce Development Initiative. We also will be pilot testing and evaluating the feasibility and acceptability of the Relational Playbook and leadership coaching as an implementation strategy with cardiology teams to enhance employee well-being and veteran care. So lots of work going on. If you're interested in participating and using the Relational Playbook, please reach out. And this work is evidence-based. We have 3 peer-reviewed publications, which are open accessed, so they are free for you to download. We also have a website where you can go and look at the origins of our program, and I have a podcast as well that I was interviewed to speak about this work. I appreciate your time, and I hope we get the chance to work together.